All right, let's talk about something that's a huge deal in the world of diabetes: foot ulcers. Today, we're going to dive into what the experts say is the single most important thing you can do to heal this very common and very dangerous complication. So let's get right into it.
And look, we're not talking about a rare condition here. Every single year, diabetic foot ulcers affect about 20 million people around the world. That's a staggering number, and it really drives home just how vital it is to get the treatment right.
So, here's how we're going to break it all down. First, we'll cover why these are so dangerous. Then, we'll get to the #1 solution. After that, we'll look at the treatment playbook, talk about what to do with tricky cases, and finally, wrap up with why this all matters so much. Okay, first things first, let's get to the heart of what we're really dealing with, because a diabetic foot ulcer is so much more than just a little sore spot. So what is it exactly? Well, a diabetic foot ulcer, or a DFU, is an open wound, and it's usually caused by this perfect storm of nerve damage and way too much pressure on one spot of the foot. Think about it like this. If you got a little rock in your shoe, you'd feel it instantly, right? You'd stop and take it out. But with diabetic nerve damage, that feeling, that warning signal, it's just gone. So that constant pressure just keeps grinding away until the skin finally breaks down.
And the consequences of that breakdown, honestly, they couldn't be more serious. An ulcer that isn't treated properly can get severely infected, which leads to more hospital stays. It's actually a leading cause of disability all over the world. And tragically, it's the #1 reason for diabetes-related amputations. So yeah, getting the treatment right is absolutely crucial.
So that's the problem. But what about the solution? Well, it turns out there is one thing that experts agree is the most important step, the key to healing. And that solution has a name: offloading. It sounds kind of technical, but the idea is actually super simple. You just have to get the pressure off that wound. It's exactly like a broken bone, right? You would never dream of walking around on a broken leg. You'd put it in a cast, take all the weight off it, You'd offload it so it could heal. It's the exact same principle here. And hey, don't just take it from me. This comes straight from the top, the official 2023 guidelines. They call offloading arguably the most important intervention. They're not saying it's just a piece of the puzzle. They're saying it's the absolute cornerstone of treatment.
So how do you actually do this offloading? Well, it really boils down to two main paths. You've got non-removable devices, like a special cast, on one side, and on the other, you have removable ones, like a walker boot. The huge difference, as you can probably guess, is all about sticking to the plan. A cast basically forces you to do the right thing because you can't take it off. With a removable boot, its success is completely up to the patient, and even just a few minutes of walking without it can undo days of healing.
Okay, so we get the what and the why. Now let's get into the how. We're going to walk through the official treatment playbook, which lays out a really clear, evidence-based path for doctors.
Okay, and here it is, the official roadmap. Now, I know what you're thinking, that looks a little complicated, but trust me, it's not as scary as it seems. It's basically a decision tree that helps guide treatment based on questions like, where's the ulcer, and is there any infection? We're about to walk down the most common path on this chart.
So, for a straightforward, uncomplicated ulcer, the guidelines have a super clear hierarchy. Think of it like a medal stand. The gold standard, the absolute best option, is a non-removable knee-high device. And it's knee-high for a reason. That extra height is way better at taking pressure off the foot. If that's not possible for some reason, the second choice, the silver medal, is a removable device. And if those just aren't an option, the third choice is to use special felted foam padding.
But what happens if those methods don't work? What if the ulcer is just stubborn? Well, that's when the guidelines point towards surgery. These are procedures designed to permanently fix the pressure problem, like lengthening the Achilles tendon or even smoothing down a bone that's causing all the trouble in the first place. Of course, in the real world, things are rarely that simple. The plan has to change when you throw in other problems, like an infection or poor blood flow.
And this is a really critical question, right? What do you do when the ulcer is also infected or the blood supply to the foot is bad, a condition we call ischemia? How do you balance everything?
This table lays out the strategy perfectly. If the complication is mild, that non-removable cast might still be okay. But look what happens when things get more serious. You have to switch to a removable device. Why? It's a trade-off. You might lose a little bit of that guaranteed offloading, but you gain something priceless, the ability to check on that wound constantly. And for severe cases, well, offloading isn't even the first priority anymore. You have to treat the life-threatening infection or fix the blood flow first. First things first. Okay, let's pull all of these threads together. Let's talk about why all this matters so much and what's coming next on the horizon.
Because at the end of the day, all of this, every single guideline, every cast, every decision, it all comes down to one powerful goal: healing that wound, making sure it never comes back, and most importantly, giving people back their lives.
And that is the big takeaway here. When healthcare teams follow this evidence-based path, the results are undeniable. Ulcers heal faster. The risk of amputation drops dramatically. It just leads to better, healthier outcomes for patients. Period. So, with this solid playbook in place, where do we go from here? What does the future of this fight look like?
Well, the work is definitely not done. Researchers are focused on some big challenges: making better and cheaper offloading devices, figuring out how to help patients stick with their treatment, and learning more about how to handle those really complicated ulcers, especially in parts of the world with fewer resources. All this progress leaves us with one final hopeful question. Can we get so good at this that we move beyond just perfecting the cure and one day prevent these ulcers from happening in the first place? Now that would be a game changer.